Welcome to Shrink by Quint. I'm Quint Bower, UK CP psychotherapist with over 30 years in practice and director of Cinema, a global AI video and animation agency working within healthcare, finance and technology. This mini-series is a departure from our usual focus on psychotherapy. I'm looking at how artificial intelligence is transforming healthcare, especially mental health. These episodes are meant to cut through the hype, flag the opportunities, and highlight the dangers so that patients, professionals, and policymakers can make sense of what's coming. Picture this, it's 2 a.m. Someone can't sleep, anxious and alone. There's no therapist to call, but their phone is there. They open an AI chatbot, and within moments it feels like someone is listening. That's the promise, care that never sleeps, available to anyone with a connection. But here's the peril. A chatbot isn't human. It doesn't hear the silence between words. It can't notice a tremor in the voice. Therapy isn't only about words, it's about presence. And presence can't be automated. AI can make healthcare faster. The danger is, it makes it colder. AI is already here. In mental health, the appeal is obvious. Affordability, anonymity, and availability. For overstretched systems like the NHS or for communities with no therapists at all, AI may be the only support on offer. At Cinema, I've seen this across sectors. In finance, algorithms could predict behaviours at speed, but they could also amplify bias. In technology, AI streamlines tasks, but often at the cost of nuance. Those lessons matter now as we apply AI to healthcare. Used well, AI can make the complex accessible. It can process patterns that humans might miss, changes in mood, sleep, or speech that suggest relapse or depression. It can triage, speed up diagnosis, and free clinicians to focus on the irreplaceable human work of listening and caring. But the risks are just as real. Algorithms are only as good as the data they're fed. If the data is biased, the results will be biased. Privacy is another issue. These tools rely on deeply personal information, and protecting that must be non-negotiable. Humans will do what only we can: empathy, trust, connection. The power lies not in replacing one with the other, but in combining both. The future isn't human or machine. It's hybrid. These conversations aren't happening in the abstract. They're happening now. In government offices, hospital boards, and technology companies. The choices they make will decide whether AI becomes a lifeline or a liability. From my vantage point, I see both sides. As a psychotherapist, I know recovery depends on human presence. As a director of Cinema, I see how quickly AI spreads once it's adopted, and how important it is to explain it clearly. And from working in finance and technology, I know how seductive convenience can be, and how easily it gets mistaken for care. The real challenge isn't whether AI will change healthcare. It already has. The challenge is whether we can hold on to dignity, privacy, and empathy in a hybrid future where humans and machines work side by side, because convenience isn't the same as care. You've been listening to Shrink by Quint. I'm Quint Bower, psychotherapist, consultant, and director of Cinema, where we specialize in using AI and animation to make healthcare innovation clear and human. These are the questions I explore with organizations and at conferences, and I'll keep returning to them in this mini-series. You'll find companion articles and resources at quintbower.com. Thanks for listening.